guys, Kati Kleber here. We are going to talk about different options for those of you who do not get that med-surg, ICU, acute care job right out of school. It happens. We don't always get the job we want to get. And so what do we do practically? What kind of job should I be looking for if I didn't land that residency program or that job I was like banking on? What should I do now? Well, there's actually a ton of options out there. So let's go through some of those. Number one, outpatient dialysis. So basically, you get a lot of patients in this world that need dialysis multiple times a week. And I don't know if you've seen those different dialysis clinics pop up in different areas, but you can, as they need nurses to run those machines and run the dialysis on patients. Someone on Twitter said dialysis is kind of like med-surg, but more blood. So you still are definitely getting a lot of really good clinical skills, accessing fistulas, drawing labs, running things, running a machine, taking care of patients, building rapport. There's assessments. There's so much that a dialysis nurse does that is directly applicable to the inpatient environment that it is such a valuable thing to look at. When I started as a new nurse, there were one nurse that started on my unit had actually been working in dialysis for a year. She didn't land that job she wanted right out of school. So instead of trying to get a different move or do anything like that, she decided, you know what, I'm going to try out dialysis. And she worked outpatient dialysis for a year, reapplied when the next class of residency was, and got in. So, that's definitely a great option. Next option, long-term acute care hospitals, or LTACs, and skilled nursing facilities. So I know the difference between the two can get a little hairy, a little muddy, because there is definitely some overlap between the two of them. But when you look at patient population-wise, the long-term acute care hospital patients, or LTACs, they're getting hospital-level care, but in more of a long-term environment. Skilled nursing, not necessarily. It's a little bit more of a residential environment kind of feel to it than the long-term acute care hospital. Now, that being said, both of them may have ventilator units or designations where they have multiple patients on ventilators. So that is outstanding experience to have if you ever want to work critical care or step down. Patients taking care of someone on a ventilator with a trach and a peg, holy moly, that is wonderful experience. So if you don't land that job in the hospital, but hey, I want to work ICU one day, get a job in an LTAC or a skilled facility that has ventilator patients, and you will get very familiar with really crucial aspects of taking care of those patients, because you're learning how to do that on stable patients. And then when you get transitioned into that ICU environment where they're unstable, you already got the ventilator down. You already got that peg tube management. You know how important it is to position them. You know how to do a really good assessment. That is outstanding experience to have before you transition back in, or try to get that acute care job. Other options include home health. So you would be going into a patient's home, maybe doing an assessment, some vitals, checking on their meds, maybe giving them some meds, maybe drawing some labs. A great option, just making sure that if you do work home health, that you do ask them what kind of additional support and framework they have for newly licensed nurses, because you haven't done this before, so you want to make sure they give you that guidance and support. Another option is rehab. So there's rehab units where patients, they don't need this intensive, maybe they don't need the cardiac monitoring, the frequency of the monitoring of the inpatient environment, but they need the rehab. They need a lot of physical therapy, occupational therapy, maybe even speech therapy. So nurses got to take care of these patients. So you could always work in rehab, and the patients are a little more stable than the inpatient environment, but they still require those assessments, the medication administrations, facilitating interdisciplinary teamwork. Great environment. That can be acute care. It can also be outpatient as well. And finally, the nursing home. So don't write off the nursing home, y'all. This is a good job. If you can find a good nursing home, this is a wonderful experience, especially when you consider working in a nursing home and getting a paycheck every 2 weeks and starting to pay off those student loans versus nothing at all, right? If you are not finding the jobs you want and you're finding, you know what, I think I want to check out the nursing home, that's legit. You are giving meds to patients, you are learning how to work with CNAs, doing assessments, getting really familiar with a lot of Medicare situations and what is necessary from that perspective. And speaking as an inpatient nurse who's never worked as a nursing home nurse, I send patients to the nursing home all the time. It would be really, valuable to understand that other side of patient care. And as you go into an interview, let's say you want to work med surg and you did some time working on a nursing home, you can speak to that in your interview with confidence about how, we get patients from the hospital all the time, and I know about the process of, transitioning someone from the hospital there, and I feel like I would be a very valuable asset to the team of being able to articulate the kind of very important things that nursing home nurse needs to know that you're sending this patient to. Boom, that is great, hired, hello. So nursing homes, if you're looking at those, I just highly recommend that you, when you go on the interview, you're really paying attention for things like how they're going to onboard you, what kind of an orientation experience you're going to have, how long it's going to be, who's going to precept you, who's going to teach you, how long have they been there, how long have they been a nurse. I would also be asking about leadership. How long has leadership been in the positions that they're in? How long has leadership been a nurse? Like, is this director of a nursing home a new grad? do they know what it's like to take care of patients, or have they been here for 10 years? And do they have 3 or 4 licensed nurses that are awesome and love their job and been there for 10 years or whatever it might be? You really want to ask those very specific questions to ensure that you're going to a nursing home that's going to support you, that's going to be involved in very ethical care, that you're not going to be worried about your license and you're going to be like, oh my gosh, why did I do this? You want to ask those good questions up front instead of finding that stuff out later. So that's another great option. So the ones that I went over, just to go back through them: dialysis, long-term acute care, skilled care, rehab, and nursing homes. And I do want to say a quick thing about psych, because you do psych outpatient as well. This can be a great option as well. You get very good experience with that patient population. Now, granted, you're not going to be doing the kind of things like you would be doing on like an LTAC, where you're turning patients, working with CNAs on doing direct patient care. The patient care looks very different there in psychiatric nursing. It's much more about the medications and about talking, and you're not necessarily, you're not dealing with IVs or PIC lines and that kind of thing. It's different. So consider that, if you decide to do some psych nursing for a few years and you do transition to the hospital, that transition might be a little bit more challenging than if you were in like an LTAC or skilled nursing, or even actually a nursing home as well. So just keep that in mind. It is a very viable, great option as well, but it's something you definitely want to consider. So if your like ultimate goal is to be an ICU nurse or a flight nurse or an ED nurse, I would lean towards something like LTAC, skilled nursing, dialysis, than psych, if that makes sense. If you want to be a school nurse, if you want to do inpatient psychiatric, or if you want to be a psychiatric nurse practitioner, I would absolutely do outpatient psych out of school. So those are just some options for you, and I hope those help you make some decisions in where you should apply.